Our first guest today is Dr Carolina Gonzalez. Carolina is a Chinese doctor and an expert in preventative medicine, fertility, holistic therapy, DNA therapy and nutrition. She sees clients in her busy clinic in Albert Park, including many celebrities. Carolina is going to share her amazing expertise on fertility today. Welcome, Carolina.
Thank you for having me today, Briony.
Well, I'm very excited to have you because I think fertility is such a topic that's very personal for a lot of women and it can be a sore point. So I think it's a really nice thing to cover, and you help so many women become pregnant. Why is it, do you think, that so many women are having issues in this area?
Well, currently in Australia, it's been documented that 1 in 6 couples is going to have issues in conceiving.
Wow, it's a lot, isn't it?
It's a lot. And I guess that there's a few things that we need to look at. As a society, we're actually leaving it till later to have our families.
Mm-hmm.
That's number one. Number two, most women are actually using the contraceptive pill as well.
Mm-hmm.
And the third thing is also that we have actually, as a society, become so busy. We are so stressed.
And just to stop you there, so why the contraceptive pill? Is that contributing to infertility for some women?
For a lot of women, when women actually are introduced to the pill, some of them, the women that I see at my work, some of them have been taking the pill for more than 10 years.
Mm.
And in that time, the pill is actually sending information to the body, and it's saying to the body that the body is actually pregnant.
Mm.
So therefore, the body is not ovulating for a long, long period of time.
Yep.
When the woman decides to get off the pill, at times it can be quite tricky for the body to regain its balance.
Mm.
So the first thing that we do in our first consultation is have a conversation as to how the woman has experienced her menstrual cycle and where things are at. We take some time to investigate where the body's at.
Mm-hmm.
And really the main thing is just to get the body back in balance, to ensure that the woman is actually in a place of happiness,
Mm-hmm.
in a place of balance, really, because it can be a time of stress.
And how does stress contribute to the infertility as well?
So when the body actually experiences stress, a number of things actually happen. The first thing that happens is the body gives priority to the things that are going to allow the body to survive.
Mm.
So blood gets pumped through the heart, to the brain, to the vital organs. Unfortunately, the uterus and the ovaries are secondary organs.
Yeah.
So when the body gets stressed, it actually stops sending oxygen and blood to those areas.
Mm.
So therefore making it tricky for those parts to communicate well with the brain and with the body, and so at times shutting that down. And that's when we actually see things like polycystic ovarian syndrome and ovulation, which is when the body stops ovulating.
And that's really hard, isn't it? Because a lot of women, when they can't get pregnant, they get really stressed as well on top of it. So it's a balance. You help people, relax people and help them with this part of it?
Yeah, so I guess that one of the things that we do is we employ a preconception care program, and within that there are things that we do, like we do pathology, so we find out what the bloods are doing, whether we're ovulating, we check for hormones, vitamin levels, we check for nutrition as well, what the woman's actually eating. We clean up our diets, so it is recommended that we actually start eating a clean diet, that we are having enough water in our diet, that we're having organic foods, that we are really, really allowing the body to clean itself from toxins. And those toxins can range from recreational drugs to cigarettes to excessive alcohol to too much coffee.
Mm.
At the same time, having this conversation with the person that rigidity can also be an issue. So it's about being able to flow in the balance of not feeling guilty. So really employing a lifestyle that's clean, knowing that we can only do the best we can do.
Yeah, and what about for men? Because obviously a lot of women, they take it on board really personally, and it's very hard, and a lot of men don't really think about it. So where do they come into the picture?
So I guess that the first consultation at the Nature of Balance is preferably with both people in the room. Both the female egg and the male sperm, it takes 120 days for that to actually for it to be ready for conception. So for the men, I recommend for them to go and get checked for the quantity of their sperm, the quality of the sperm, and how they're actually swimming as well. So if any of those things come up, like if there isn't enough sperm, if they actually have too many that are not looking so good, or there is problems with the way that they're swimming, we actually put them on a detoxification program. Because we know that within 120 days, the next batch, if you want to call it that, the next batch is going to be clean and it's going to be a lot better. So with fertility, the body has an incredible intelligence of self-healing, and all we're really doing is really creating the space for that to occur.
And, you know, a lot of men happy to go on these diets and support their wives, because that must be a challenge as well.
It can be tricky, but sometimes what happens is, you know, I see people that are coming in at all different ages and at all different stages. So if I'm looking after a 24-year-old person that just got married and wants to start their family when they're 25, there isn't so much urgency. But what's happened now is that there are more women having children over the age of 40 than teenagers.
Wow.
So if
that's massive, isn't it?
It is. So therefore, if I'm actually taking care of someone who's over 40, then the priorities are a little bit different, because we've got time constraints, and we also have to have a look at what we can do to improve egg quality. So if we're looking at egg quality, we have to have a look at sperm as well, knowing that there's a limit of time. So at that time, men are more than happy to actually explore taking antioxidants and reducing their toxic load. And
so for people out there who are obviously struggling to fall pregnant naturally, do you have some tips that they can kind of undertake right now that can help them?
The first step that I would recommend is to find something in their lifestyle daily that cultivates happiness. For some people, that may be dancing. For some people, that may be meditation. For some people, that may be walking in nature. But we've got to remember that a baby comes when the heart and the uterus is connected and they're having a conversation. So the first thing is cultivate happiness in whatever brings you joy on a daily basis. The second thing is clean out your home and your lifestyle as much as you can from toxins. So walk around your house and have a look at how many toxins you're actually utilizing, and just reduce that toxic load and go for options that are fertility friendly and eco-friendly. When it comes to diet, give up things that you know are not are toxic. So for example, fizzy drinks, sugar, junk food, trans fats, alcohol. More than 2 cups of coffee a day are actually shown to be a problem when we're trying to conceive.
So only 2 cups of coffee a day can affect your fertility?
More than two.
And
from a genetic perspective too, you know, like some people are actually predisposed to having heart issues if they're having more than 2 cups of coffee a day. So as a rule of thumb, 2 cups of coffee is more than enough on someone's daily diet.
Yeah.
Then the third thing that I would do is employ clean living as much as you can. As much organic as you can, remembering that every single cell in the body, for it to be alive and for it to be the best that it can be in its water, in its oxygen. So movement is very important. Something that's nurturing and nourishing. So we're looking at things like yoga, we're looking at things like Nia, we're looking at things like dance, swimming, Pilates, nothing that's going to be too strenuous. And the third thing is having a diet that's rich in antioxidants. So every single cell in the body really needs oxygen, water, antioxidants, and nutrition. Most people are actually recommended for them to actually take folic acid before they try and conceive. But as a genomics consultant, I see that a lot of women have got an MTHFR gene mutation, which means that they can only really absorb folinic acid, which is the activated form of folate.
Wow.
So I would recommend that if you haven't had your DNA tested, that you go off and that you actually have a look at a multi that has got activated forms of folinic acid.
And that can be, especially with some of the genetic problems that occur if you don't have enough folate, this can be really important for a lot of women, can't it?
Yes, and it can actually be like an aid in prevention for miscarriage as well. So I would definitely recommend that we do that.
Wow.
If you're over 40, I'd be looking at things that will definitely increase the egg quality. And there are a number of supplements that we can use for that as well. But as a rule of thumb, I would recommend that you see an expert in this field.
Yes,
to
definitely.
actually assess what it is that you need personally.
Well, I've learnt a lot, Carolina, and I think you're an amazing practitioner, and you're somebody that I went to help myself fall pregnant, and it is such a topic that's dear to my heart because it can be really tricky for a lot of women. So the take-home message is that there's lots of that people can do within their diet and themselves to help, and there's amazing practitioners like you that they can go see. So if anybody wants to see you, where can they find more information?
You can go to thenatureofbalance.com.au